let's rock this out. So I'm going to call the meeting of July 20th, 2023 to its beginning. And I would like to initially ask for permission to change the agenda to add a third item under old and continuing business, a brief discussion on the Health Net grant, of which you should have. I think everyone should have a letter in front of them that just came today at 3:30. No, actually, it wasn't even 3:30. It was 4:15.
Well, I appreciate you getting this. That's perfect.
And there's probably a little explanation that needs to go with the reason that they haven't dispersed even half the funds that we've given them for this year.
I move to adjust the agenda as suggested.
Yes, so I think are there any objections to that? Do we need a motion and a vote to adjust the agenda?
So I'll second.
Okay, did you move?
I did.
Okay. Those in favor of adjusting the agenda to include the Health Net grant, please say aye.
Aye.
Opposed? Okay, motion passed. Okay, well, welcome everybody. And I guess we're going to go right to the updates.
Lindsay. The public health clinic, Lindsay's going to give the clinic updates.
Yeah. Oh, yeah.
Can you guys hear me and see me, or just hear me?
Hear you?
We can hear you.
Let's see if I can change anything on my
There you go.
end. How about that? Is that better?
It is.
All right, good to see you all.
You look good in blue.
Oh, thank you. It's one of my favorite colors. So this is my first report after stepping into the RN supervisor role here at the Monroe County Public Health Clinic. This is my first week actually, so it's gone well. And so it's a privilege to collaborate with you all. We here hope that we can continue to serve our community together in great ways. So I just wanted to mention that. And Zara, I can't say enough good things about what she did for our clinic. And so we just want to keep stepping in that direction as well. So thank you all. It's good to be here. I'm going to hop right into our update. So as far as immunizations, we do still have adequate supply of all the ACIP recommended vaccines. That does also include the Pfizer and Moderna for all ages. We are still giving a few monkeypox vaccines as well, and they still are available. And then so we have news that a new COVID vaccine formulary will be coming this fall. They just haven't given us any of the details regarding that. So as soon as I get that information, I will pass that along to you. So we're anxious to get that information as well. So once we have it, like I said, we will pass it along. And then I'm going to report on the TB and communicable diseases. This information is coming from the people who are specialized in that area. I do have a general knowledge of this information. So if you have specific questions, though, that I cannot answer, please still ask them and I will get the information to you that you need. So our DOT patients, there are less than 5. Our LTBI patients, there are 24 cases that we're following. Communicable diseases, we have 21 cases that we're following, with 17 of those being hepatitis C, past or present. And then lead cases, we have 8 that we're currently following. We have had a good and busy month thus far. So on July 8th, here at our clinic, we had a wellness event and we targeted the Hispanic population. We had great success in that. We had 25 patient encounters, so that was a great day. On July 15th, we were at the farmers market and we had less than 5 encounters there. And then on July 19th, which was yesterday, a group of us were at reserve at Chandler's Glen, and we had 15 encounters there, 15 patients that we encountered. So that was great. As far as future community events coming about before our next meeting next month, on July 26th at Crestmont, I believe they titled it Parents Night Out. But there's going to be a lot of people within the community. We're going to be there giving immunizations, doing blood pressure screens, and then our lead nurse is going to be offering free lead testing for any child 7 and older, and that is through the state. So that will be a great event. And then on August 5th, there is a John Ross, who is a former pediatrician within the area, a memorial bike ride, and it's called Bike for the Kids. So we will be there doing cardiovascular education and blood pressure screenings. And then August 12th is our Smart Start event here at our clinic on Miller Drive. And so we will be offering all of our back to school immunizations. We would like for the public to call to schedule an appointment if they can. Now, if we have a walk-in, we'll try to accommodate them as best as we can. But we would like for them to call. And we've been talking with Jamie about that, and Kathy. Jamie has been advertising this for us on social media, website, and she made a really nice flyer. So if we can advertise that as much as we can, that would be great. So we're looking forward to that. Questions?
Sounds like you're going to be busy.
Yeah, very busy, but good. These are all good things. So yeah.
Are there lots of organizations that are going to be at the Crestmont? You said there are going to be a lot of people there.
Yes, there will be other entities from community health. So I know there's going to be people giving away bicycle helmets to the kids. I'm trying to think of other things. I know there's a few others that will be there, and I've not attended there before, but I've heard it's a large event. Oh, and they're giving away free shoes for back to school. So,
Do you know if HealthNet is going to be there?
that I do not know. I would assume probably so, but I'm not sure. I can find out if you'd like for me to.
Well, we can find out, but I was just curious if there are 2 FQHCs here now, so I was just curious if either one of them were going to be there.
Yeah, I hope they are. It'll be a good event. So,
Okay.
yeah.
Any other questions? Thank you.
Thank
Very
you.
good.
See you guys soon.
Okay.
Okay. Thank you. Bye-bye.
I am assuming that
Hi,
Dr. Herman
Shelley.
is here. Yeah.
Sorry, I went to the wrong building.
That's okay.
And then I stood out there for 5 minutes, texted you and said, how do I get in? And then I thought, I wonder if there's another door. Hence, I was 5 minutes late, sorry.
So Dr. Shelley Herman, our
Hi.
newest board member.
Welcome.
Hi, thanks.
You're welcome.
Thank you.
So do we have an extra agenda? So Dr. Herman.
Thanks.
There we go.
Thank you.
We get a name tag too.
And we just added an item under old business that we'll be talking about the HealthNet prenatal care grant. For no big deal.
Great.
All right, Lori, you want to
Yes.
jump in here?
Do we need to
With
approve previous minutes?
I'm sorry?
Do we need to approve previous minutes?
That was my
Well-
fault. I didn't have them ready. I didn't moderate.
Okay, so we're not doing that.
No.
Yeah.
Okay,
We don't have
I'll have
them.
them for
so-
next. Thank Awesome. Sorry about that.
no.
She had her
that's
hands
fine.
full. Yeah, she had well, anyway, we don't have them. So
Who's
we'll,
Lindsay Shipley? I know who that is, but what's MCPHC
Monroe County Public Health Clinic.
Clinic?
Yeah.
Got it.
Okay, so there are quite a few updates here, so I'll just do a brief overview, some of the highlights here with our staffing updates. So Evan has onboarded into the clinic manager role for Futures Family Planning Clinic. He is doing well. Eric, the previous clinic manager, is still bouncing back and forth a little bit between the financial manager position and then assisting downstairs for that smooth transition. Avery Thomas was previously an intern with the department with population health, and she is now the tobacco educator. And interviews are taking place tomorrow for the harm reduction position. So we have 3 candidates we will be interviewing for that position. Just recently approved another round of local radio ads for the lead risk in children. So if you hear those should be playing again starting on Monday. Wastewater is still busy working on inspections and permits, as well as updating the code changes that will be coming. And foods, busy with routine inspections. They just finished the Monroe County Fair. They've attended various trainings, and the new senior foods specialist has completed her ServSafe certification. So, the general section have most of the seasonal pools completed, and Cody and Simeon have been assisting with the wastewater with getting the backlog of complaints. So they've been a huge help in that area.
How many positions do we currently have in the field?
Total for the department, well, just for environmental, no, for,
3 DIS.
So 9 EHS, and then 3. Well, population health is kind of in and out, so.
Say about 12, 15.
So there's 2 full-time permanent wastewater positions. We still have the temporary who's been helping in wastewater. The environmental manager is acting as a field working manager, so he's been assisting, and then now general is helping. So
Lori, are we still, since cross-training was a bit of a issue when we first started doing that, but it made sense, and it was, I think, maybe, I can't recall exactly, but we had, is it mandated now, or it's not, maybe not mandated, but it was highly suggested or strongly suggested. Are we back doing some of that at this point?
we are still working on that path.
Okay.
So with our
Still-
2 general.
Still
they-
meeting resistance just at some level?
Not like previously.
Okay, good.
But that's getting better. And yes, so just trying to frame that mindset of working as a team, helping each other out. It doesn't mean those are your duties day to day,
Right.
but being flexible
Mhm.
to help out in other areas as needed. So I think that's really been beneficial too with the manager going out and helping in all areas and working as also that field manager. So we are getting there.
Good.
Let's see, public health preparedness. There are many new deliverables for this grant. This grant will be ending in 2024. But some of the deliverables that we are going to be focusing on are reviewing and updating our preparedness plans and performing call down drills with staff and our district partners and volunteers.
Who's on that committee?
Well, I could get a list of that for you from
Are
our,
there doctors on that committee?
I do not know for certain.
Seems like it might be. I mean, emergency preparedness
Mhm.
would seem,
We do work with a lot of like IU Health and some of the, but I could get you that list.
no, but I mean like actual doctors, not doctors that teach at the med school that don't practice.
Let me
I
reach
mean,
out to Christina.
Myself, having been through a
Mhm.
number of emergency preparedness courses,
Mhm.
I know there are people that that's just all they do.
Mhm.
So
We'd
I'm
love
just
to have you.
curious.
Yeah,
I'm just curious who's on it.
okay. We'll get you that list.
Okay, thanks.
Christina has been helping with the upcoming health department retreat, which has been a huge help for me. So that's going to be the first Friday in August. So she's been helping to coordinate that training, the plan, getting food together, activities. So we are also going to be providing training for part of the day during that session. The employee assistance program is going to be coming out and doing a session on team building for us. And then we have a slot during the day where it's reserved for games and activities. Population health and outreach is busy, still working with our community partners on the health improvement plan. Futures is still working on improving the no-show rates, improving flexibility with scheduling. Jamie recently helped to create a new schedule block. So that's with inserting patients, that's been helping quite a bit. And they are looking to implement an audit plan for documentation.
You know, what kind of percentage of a failure rate? I mean, 20% wouldn't surprise me.
I'd say
Yeah.
40. I was gonna say 50.
Probably more like 50. Yeah.
It was getting better at one time,
Yeah.
not long ago.
We have some of those numbers we could get.
So I guess 20 would be good.
And then our disease intervention. So the Indiana Department of Health now has a syphilis dashboard up and running. This is on the state website. It is preliminary data for 2023, but it's being updated on a regular basis. There is a medication shortage that we are currently addressing nationwide. So we are working with the Indiana Department of Health on those procedures and practices.
I'm sorry, were you asking the percentage of no-shows for the futures clinic? It was 21% last month.
Oh.
So
I wasn't
if
off.
this were a game show, you would win. Good for you.
Well, there must have been somewhere stuck way in the back here that we talked about this before. I wouldn't have been that close.
Well, we have the text reminders up and going now, right?
Yeah, they were doing reminders and
Uh-huh.
those kinds of things, and it had improved. I remember
Mhm.
hearing about it.
I know that at Centerstone Health Services, the QHC lookalike, I know 20% is about where they are too. So that has to do with it, with your population that, you know, it's just, a lot of them just aren't used to working on a schedule and showing up for appointments. So, yeah, anyway. All right, any questions for Lori basically on her update, general update?
So how many positions are open at this point?
Just the harm reduction. Mhm.
Yay.
And they've really just been kind of waiting around for that, so.
I've been surprised at the
Good
number of
news.
applicants for the open
Excellent.
positions that we've had, so,
It's great.
yeah,
Well, and the school liaison, but we're looking to
Well,
go a different direction.
yeah.
Yeah.
Yeah, but I mean, I'm talking about the
Mhm.
employees in the department, yeah, it's. Because just a few years ago, that was not the case,
Right,
and it seems like a lot now.
yes, they're doing great.
Yeah, some of the newer people, I think, I've been really impressed by their attitude as much as anything else.
Mhm.
Yeah, really. It's really made a difference, I think. All right, shall we just jump into this grant discussion?
Yep.
This is the COAG grant is the one where we have the agreement for the grant for the schools. So we need to run through these quickly.
Really, we've gone through, this will be the third time.
Yeah, we will. Well, I mean, but we need to have a yay or nay and a reason and to recommend to the commissioners. So let's just get this done.
Okay.
Yeah.
So each one, yay, nay?
All right, so the first one was the Montessori school. And they wanted to retrofit their water fountains to fill bottles. Altering the water fountains will positively impact the school population, filter drinking. So, and our school has 11 HVAC units, some more than 30 years old. Want to use grant from COAG grant to replace one of our units that are no longer functioning, can no longer be prepared. I'm attaching 2 documents, diagnosis of the problem and an estimate for repair.
Yes, water fountain, no HVAC. Is my opinion.
Well, I agree they need clean water, but I think the schools should be able to.
Yeah, HVAC is the camel's nose under the tent edge.
Yep.
Well, and then we have coming up another grant to ask for a huge amount of
Well,
money.
we already know we're not doing it.
Yes, okay. So yes to the water filter
The water fountain,
or fountain, whatever, with
the refill.
the bottle fill,
So that
water.
they're not sucking on the water.
Retrofit.
They have bottles and
Bidding, no
HVAC.
HVAC.
So $4,000.
Yes.
Okay, the Covenant Christian School, this is the one that has the large HVAC
No,
request,
Yeah.
$65,000.
no,
That's a no,
Is that a private school?
It is.
yes, and they
But
don't.
they're asking for HVAC. So. we
And
can deny them
infrastructure
based
things
on the
are
HVAC
really,
24
And let the
room type
commissioners
air
Deal with
conditioners.
deal with
What
everything
I
else.
heard.
the HVAC infrastructure items are not recommended by the
Oh, gotcha.
State Department of Health. And
Got it,
so
thank you.
the thing you need to know, the background is that last year we did disperse all of these funds basically to the schools without many restrictions, which was probably not the way things should have been done. So
And
now-
why? Because of COVID?
So they expect that they're just gonna get it.
No, I mean, why did you guys make a change?
because the guidelines said that we probably should have done it last year,
Okay.
We didn't,
like we did.
didn't know.
And this is for
Okay.
emergency preparedness.
Yeah, exactly.
We don't replace people's HVACs
Got it.
systems.
So
Particularly.
this
not
year,
a
we
private
started,
school.
we started looking more closely at the parameters of the
Right.
grant
Okay.
and said, infrastructure is
Is
not.
there anything
Although-
wrong with COVID?
Is this a preparedness grant? I thought this was a school grant.
it
Yes,
started as
but it's-
COVID.
It's a COVID grant. So your attachment A from the state
Mhm,
is pretty clear
mhm,
in terms of what we're supposed to be doing with it.
mhm.
So that
Yeah.
question we had is contained in the attachment A.
Yes, and I think it even lists like
So it's
bleeding
kind
and
of for COVID.
AEDs and
It does.
bleeding.
Hence the water
things.
bottle.
So we should stay,
Or retrofit.
we should
Right.
stay with the attachment A and this email to the extent that we can.
And here's payouts that they've received previously.
Okay, the next one's Harmony School, requested
For their playground?
$40,000 for playground
No.
equipment
No.
and internal communication equipment,
No,
network, fire alarm, monitoring and phone to make reliable case of emergencies.
You could make an argument
Yeah,
that that's
that's
health and
emergency.
safety.
But no to the playground equipment, because that's, yeah.
it's playground equipment.
Well, what are we gonna say? I mean, because it's internal communication equipment, network, fire alarm, monitoring the phone to make reliable in case of emergencies.
And you said this is all COVID/emergency stuff.
So that,
Hard to say no to that.
right, it makes sense. Why they're not doing that routinely is beyond all of us, but at least that one makes some more sense than their playground equipment.
At a minimum, health-related items.
Okay, well, I'm gonna put. This is for the commissioners. They have to make the
Right.
decision. So say. Possibly,
Plus
I put question mark, possibly some merit. I'll let them decide what it is they want.
I think that's a good idea.
For the internal communication.
Yes, yeah, no to the playground equipment. That's definitely not
And
a,
then possibly
to number 2 and make them make the decision.
And number 2, possibly some merit.
Because they're supposed to.
Edgewood Schools wanted us to clean their carpeting, right?
Yeah, well, yeah, yes.
I don't
The
understand.
carpet
Is it a
extractor.
cleaner?
Yeah, it's a carpet extractor.
It's
a
like
cleaner.
that little monster thing at Sam's that follows you around.
Can we just say no?
Yeah, that's what we're saying.
Yeah.
No,
Okay,
we don't
That's
clean their
easy.
carpet for them.
that's easy.
No. 7 Oaks. Chilled water filtration bottle filler. I think
Well, we have to
We have
say
to
yes
say
to
yes
this.
because of that, because, yes. The second item was Santa Spray whole school viral disinfecting electrostatic fogger. That's a mouthful.
That sounds like
Sounds
something
like
that
hocus
would be
pocus.
COVID related though, but if
Do we,
it's,
but it works, is there any efficacy,
No, I can guarantee you.
that it's
probably
not,
doesn't do that.
no, I'm sure it doesn't, which is why it's like, that's pointless.
Yeah, I don't.
I mean, if
don't-
you're a bug and you're standing right in front of the spray.
Maybe a mosquito.
They need 99.999
That's
HVAC filtering.
I know, okay, so we'll
So
say.
is that a
Can
yes
you
or no?
recommend to the
Questionable.
commissioners that they ask for data supporting its efficacy?
It's just.
That's good. They just ask for whatever they want routine.
I think
Yeah,
the
they all do.
commissioners just want a quick
Yeah,
recommendation and they want to move on.
And-
They
okay,
don't wanna do
vinyl
this.
nurse recovery beds. I don't even know what that is.
okay, no.
Recovery from what?
Anything.
$13,000 in HEPA filters.
With you ultraviolet.
That's a COVID thing. I'm not saying they should get it.
It
but
is a
that's- they're
COVID
using
thing,
the
but-
COVID language.
I would bet none of the other schools have that.
Which school is this?
7 Oaks.
7 Oaks,
It's a small private school.
where you must be Christian in order to be on the faculty. But the commissioners get to address the fact that it's federal.
Okay, I'm gonna let them decide. I'm gonna put, is that okay?
I
Some,
think that's fine.
some
Merit.
merit again.
No,
Of course, they should have all been wearing masks, but we won't even go into that.
Well, yes, I wasn't gonna go into that, but
maybe
Yeah,
we
but
could
they're
just give
probably
them
doing
some
better
money
on
for
their
masks.
yearly
Masks, yeah.
Then,
This is the
Been
school that
riders.
refused to wear.
We'll let
masks.
I'm just saying, they're still probably doing better on their exams.
okay. St. Charles, actually, St. Charles,
Oh,
as
this
it
was-
turns out,
this is
has
a wild one.
a valid, right
Yeah.
according to the
A
guidelines,
whole lot of these things are not.
4
listed.
AEDs.
So
be wall
that's,
mounted.
that's
I
acceptable.
think that's good.
But for the size of the school, I mean, we're talking about,
Yeah.
we've been talking about giving one to school,
Make
not
sure each
4
school
for
has
one
an-
school.
Well, 4 sounds like a lot. to
That's
me.
excessive,
Okay.
So maybe,
unless
Two.
they're all
Each
going
school
into
should
fit
receive
on
an
a
AED.
regular
Same
basis,
time.
maybe 2.
all over the
I don't know,
school.
What's the cost of? what's
They're
the
all getting,
child?
Well, do other schools, I'm surprised that other schools maybe already have them. I have.
no, they don't,
I doubt it.
Well, they
they
need,
don't, exactly.
That's
but they
the
didn't
point.
request them.
That's
They
our
do need
point,
them.
is
And they need training and
exactly, they need people who actually know how to use them and when to use them. But they don't need 4.
Okay.
And
4 premium bleeding control kits, $857.
Or what?
Premium bleeding control kits.
they're looking.
Those are
for-
actually listed
Yes, I know.
in the
what they are.
guidelines.
Those
Yeah.
are in the
No, I know
airport.
you know what they
No,
are.
but they're in the
We don't-
airport. Do they need 4?
They don't need that many. I mean, unless they really are planning
Ask
on
them.
bringing in a shooter.
We're
That's
teaching the
just-
kids to use chainsaws.
That's a thought.
I feel like honestly, I've seen one of those at the Indianapolis airport, one at the
Yeah,
airport.
For the whole,
Okay, they're planning for an event,
Yeah,
4 large
exactly.
trauma bags.
no,
I wonder what
I would
that
say no
is.
to all
Do
of
you have any
those. I don't
idea
even know what
that
they
is?
are.
And 60 go kit with bleed
Plus
control.
bleed control.
no,
What's
can
the
have
difference-
one.
What's the difference between that and the other one?
The blood thing, yeah, I don't know.
Nobody knows.
So yes to AED.
60 of them, 60 of them at $95 a piece is $5,700.
Keeping track.
What is the name
Oh,
of
I don't know.
that
if
thing?
it's-
It's 60 go kit plus
But I think. the
with
school
bleed
should
control.
award If they don't.
No.
I'll look it up.
Well, so no to any of them or?
Well, they don't need 40 go kit. I mean, how have
No,
they been
not
managing
40.
this for?
60.
60, oh, sorry. They
60.
certainly don't even need 60 if we don't need 40. It's just like, what have they been doing up till now?
Well, I don't know
I mean,
whether,
an EpiPen might be handy, just in case the kids are outside and get stung by a bee, but none of them are asking for an EpiPen.
yeah, I don't know.
Maybe they don't know.
Those are by prescription anyway, I think.
So what would, to have
Yeah.
bleeding, you guys know more about that. I don't know much about these bleed control kits. So
Neither do we.
would 10 be a reasonable number of for
they don't
those?
need-
It sounds like
They
there's,
don't need them.
they don't need
Unless
any
they
of
have
them.
the hemophiliac that they are regularly cutting. It doesn't make sense.
Body gels and tourniquets. and-
Yep, it's,
Well, but it does fall under the guidelines of bleeding.
but it's a,
It could be
sm-
in stop the bleed kit.
so put on a tourniquet, raise the limb and get them to the ER. We don't need to manage the entire bleed on the spot. And I still look at that and go, what are they doing at St. Charles?
I'm telling you, they're planning for an
Oh,
event,
obviously.
yeah.
But it's not the kind of event we're looking at as we look at expanding
Okay,
our preparedness in terms of all of
is this okay if I put maybe a few? But
Maybe, maybe one or two.
And
Okay.
remember, I have to present this to the
Maybe
commissioners, so
one.
it's something that's simple.
I'm happy to show up at the work,
Okay, that's
at
great.
their work session and say, no, it's crazy.
Excellent.
I mean, the commissioners know it's crazy. They just want us
Can
to
we
confirm that it's
suggest
crazy.
that each school have one AED if they don't have it already? And maybe one bleed kit if they need it.
Yep.
You know, each school.
well, I
To
think
me, that makes more sense.
every facility should have an AED. If they have it,
Exactly.
yeah.
I think
We've
they
already
should
said that. We said that at the last meeting.
of course, they're not asking, and not every school.
Is
Are
asking
they asking for an armed guard to prevent people
from shooting.
That
to-
would be more useful
Really?
than all the police kids.
metal
So are we at the
detectors.
project school? I think so.
Yeah, and they,
So I love their
but
proposal,
yeah, but it doesn't fit.
but I don't think any of it falls under the
None of it
guidelines
fits.
of the grant.
Okay,
They want to plant a garden.
yes, and I don't see anything on here that wouldn't fall under the infrastructure
No.
type.
No, so just move on. It's a big no. Too bad. Love proposal, not ours. You can have an AED instead.
I take it. I mean, if I were school,
Yeah,
It won't
that
be
could
as-
actually save someone. It's not that complicated.
So that was the last one, right? We're done with that?
well, it's pretty self-explanatory.
Yes.
You put the
Oh.
panels on, it tells you what to do, so, yeah.
What did they ask?
Yeah,
for?
it's self,
Oh,
Directly.
they wanted.
Actually, I think that's it.
No,
wait,
we've got one from
MCCSC.
MCCSC there.
Oh, that's right. Yeah, we're.
For a nurse educator
Yeah,
and consultant fees
Did I
to
skip
plan.
over it?
It was right after the project school. It was right after, it. I thought it was a separate item too. I didn't realize that was another.
Oh,
proposal.
yeah, okay, there it is.
What is it?
So they're asking for $60,000 for a nurse educator. They're asking for $60,000 for consultant fees for planning for future health emergencies and conducting an external audit of all health offices in MCCSD.
so
You know,
Isn't the school
Liaison.
liaison person in that role?
yeah, they don't need a separate.
They don't need a separate nurse educator.
No.
And as far as the planning, that should be done in every school with the school liaison.
Yep. So we're saying our school liaison fills that role and we're not giving them $60,000 for a separate person that will only serve the schools in Monroe County.
Okay, yeah, it actually says consultant fees for planning for future health emergencies and conducting an external audit of all health offices in MCCS. Does anybody else have any other thoughts on this? George?
I think all those health offices ought to be audited at the beginning of the school year every year.
That's what the summer's for.
So, no,
No,
So have we just,
Who does the audits?
in not
we're hoping.
funding a whole lot of these things, have we just not spent the grant? And there's gonna be a whole lot of leftover money that we're gonna have
I
to.
don't
do
have
something
kids,
with?
so I don't know how that works.
Yes, after you've met the grant deliverables, the health department can retain the funds and use
It's
those.
the school
internally. So
administrators ought to be
there
doing
is
this
money
rather than
because there
hiring
is
in
money
consultants. And
Got it.
in the 2022, 2023 in this
over the
grant,
top.
we've just been paying for salary expenses for the one school liaison, training, travel, and then we've spent some miscellaneous money on supplies and services such as CPR and
So are we
EpiPens.
gonna be in the position of turning back several thousands of dollars to the state health department because we could not spend it? Is really
No,
my
we're
question.
allowed to spend
To
it.
keep it.
allowed to
within
spend it in the
revenue.
department. And actually, it's my
Set up
understanding
emergency fund.
that, Lori, it's my understanding that most of the departments are retaining a reasonable amount of this money, and is that correct?
That's correct. That's what I was told.
Uh, You know, even though they didn't ask for it, we might be in our letter to our explanation. We might want to point out some of the things that we have approved, such as bleed kits, AEDs,
Water.
water filtration, things like that, so that if these schools didn't put it down, they thought, well, we can afford the AED, let's put down the carpet extractor. But they don't have an AED, or they only have maybe one in one area of the school, depending how big it is. They may want to ask for that. For instance, MCCSC, does every school have one?
I couldn't
I mean,
answer
that's a lot
that.
of schools,
What about it?
A lot of schools.
a lot of schools with a lot of,
I agree with you. I'd like to see the money used appropriately per the grant.
well, yes, we definitely want to make sure that everyone has adequate equipment for an emergency. And that's why I would make that recommendation that we see it as every school at least have one AED. So Jamie, make a note of that. Okay. So that was enough. Further discussion on the grants. Okay. We shall move on to the school liaison contract.
Uh,
It seems to me that if we're retaining for the health department some of these funds, they ought to go into something like a reserve of supplies for medical emergencies in the nature of masks
mhm,
and ancillary equipment.
mhm.
Can they go this is a question, can they go into some high interest bearing account? Where they sit, or is that illegal because it's a state money or city, county money?
I don't think they want us in that business.
Why? I mean, they're just, where's the money? Where does it sit?
And one of our county funds.
So it has to be, okay, so it has to be in like a designated emergency.
You can make it like an emergency fund. Mhm. Okay, school liaison contract. Oh, can we, should we officially vote on these?
I don't think so. They're simply
Okay.
suggestions.
Yeah, they wanted recommendations and
And
that's, yeah, I don't think that's not binding. It's not our decision.
and let me know when you're meeting with them. And I'm
I would
happy
love that.
to be there.
Thank you.
Thank you for doing that.
Sure.
Okay, so school liaison contract, so I am proposing that we consider doing contract services with IU Health for our school liaison program. This would be similar to our public health nursing contract services. One of the changes right now is this contract would ensure that we are following the grant guidelines since we are still currently in a grant, meaning that the person with IU Health would have to have a position that is school liaison and only school liaison within those services and providing all of the services as required by the grant. We still ensure that that person is meeting all of the deliverables, submitting the red cap surveys, and following all of the grant guidelines. I have proposed a budget that is broken up this position with the 2023 grant could be funded for 4 years with a full-time school liaison and with a reserved emergency fund and some money set aside for support services and programming support throughout the 4 years.
So would they be an employee of IU Health or an employee of the Monroe County Health Department?
Well, there would be it would be like a contract worker.
And what are they gonna do? I mean, I heard you say deliverables, but
So fulfill the school liaison, so required to work with all of the schools in Monroe County, ensure that their communicable disease plans stay up to date, provide CPR training and certification or access to those services.
They also
Got
do
it.
the school vision.
I think it's all the
and
stuff that's in attachment.
Yeah.
Yeah,
Yes, that's
there's a
exactly what I was gonna
vision.
say.
There's a vision thing in there, so. if
Yeah,
want
you haven't
one of
seen
these
this
packets,
stuff,
it's-
so,
it's
but
No, that's
all right
It's
there.
defined.
I get it.
It's a whole lot of stuff.
Yeah.
It's a ton of stuff.
I mean, I think after giving some more thought, my long-term plan for this position was to be able to fill the capacity with the school liaison, but also support the public health clinic because our public health clinic is so short-staffed. They need help with the vaccination clinics, the vision clinics. This person will be able to actually be on site with our nurses, helping to in that capacity.
Now, this contract employee, because they're not actually working for us, were we doing some cost sharing on this particular thing? That we were to go, maybe I'm get this confused with something else, but we were talking about with public health nursing about what they needed to, or not public health clinic, about what they needed this person to do, how much it was going to be, what they thought they needed. Is that all correct?
So I have negotiated that amount down to salary expenses of 55,000. So originally the mention was 70,000. But then with the $5,000 increase per year for the 4-year cycle. And then set aside money that could cover training and travel expenses and supply services as we currently do for our school liaison.
Okay.
And according to the grant, that person can only be the school liaison. They can't have any other duties.
Correct.
So
Okay,
I
well-
think that sounds fine.
Yeah, we might want to vote on this because we're approving, giving Lori the permission to contract this person. So,
move.
Go ahead,
No,
go ahead.
ahead.
No, you're,
Please.
you're
No,
better
no,
at
no,
constructing
no.
motions than I am.
No, I was just gonna move that we,
Move to support Lori in contracting with IU Health for the school liaison position.
second,
great. It's been moved and seconded. Any further discussion, questions for Lori? No? All those in favor, please say aye.
Aye.
Opposed? Great, motion passes. All right, great. I can take a moment of privilege here. I will explain this grant because I have spoken with, I don't even know what I do with it now, but it's here somewhere. HealthNet has been funded in part for their uninsured prenatal program by a grant given by us. It appears in 2020, and I don't know what happened to 2021, but in 2022 says that we gave them 15,000.
That sounds right.
That sounds right. Okay. For some reason, 10 was sticking in my head, but okay, it's 15,000. And they used 100% of it in 20. They will use 100% of this money this year. They have only to date used $3,800, and part of that is because IU Health has delayed their billing for some unexplained reason, despite numerous requests. This is totally unlike IU Health. To delay this billing, and finally Shelley Salee, who was the clinic coordinator, said she spoke with someone in billing at IU Health just last week and thinks they're finally going to get this straightened out. They will have spent all of this money and more by their own funds by the end of the year. So my recommendation is, and they really need this money. This money goes for anyone who's uninsured who needs prenatal care. Only the uninsured or ineligible to be insured. So what we're talking about a lot here is the undocumented. So I would recommend that we renew this grant for the next year and have that as part of our budget. That's my recommendation. But there's other discussion.
So I think it appeared on some document as $10,000. So I don't think you pulled that out of your hat. So I'm not sure if we're giving them 15 or 10. You guys,
I believe that it was 15 because I believe there was a discussion previously about a $5,000 increase, and then maybe in the future, the $5,000 increase that went to Health Net might go to Tandon.
Pardon?
Which one
To
is it?
Tandon?
Yeah. Mhm. And that was just on old notes that I found.
But it sounds, I mean, clearly they're getting $15,000.
We can run reports on the actual amounts that's been paid out.
I guess I would like to float the idea that we increase it by an additional $5,000 since they're spending all of it and more, at least for this year, they'll be spending. So I think she said she's got 18,000 outstanding.
They've dispersed 18,000 of that 30 that's been,
But what IU hasn't billed for yet
Yes.
is going to eat up all of this and more.
yes. Yeah.
So
And of course, here we
they're
are, we're just
using it
mid-years.
appropriately on a very needy group. So if we have $5,000 more, I would be happy giving them 20,000 a year.
I would not argue against that at all. And we do have the money.
I put 20,000 in the budget, and if the county opts in, it'll count towards one of the core services. So.
Okay.
Okay.
Do we need to vote?
Oh, yeah.
Okay.
Need a motion.
I
I
move
think
that
it's
we
George's
give,
turn to do it.
Okay, I move that we fund the prenatal care grant to the tune of $20,000 for the next cycle.
I second.
All right, any other questions for Lori about the
How do
prenatal?
they find out about patients, the people? Do you know?
I don't know.
How do we
Because I
find,
see a fair amount of people who, who don't have any money in their insurance. I'm just wondering, how do they find out about it? Is it advertised through Health Net or?
I'm going to say currently 8 women have applied for the support.
Right, but that's 8 women in 80,000 people.
Yeah.
There's a lot more than 8 women.
well, if they
just curious.
went to Health Net, yeah, I mean, they know that Health Net has a sliding fee scale, treats people.
Somebody
Okay,
has
so
to-
it's
Can't turn-
has to refer them
cannot-
to Health Net.
To Health Net.
To be an
Okay.
FQAC, you
Yeah.
cannot turn a person away for
Right,
not
obviously.
inability to pay.
Right. So if they get to Health Net, then they find out about it.
Yes.
Okay.
Guess the only other question I have is, what other means is Health Net using to reach out to the community or otherwise to get funds to support this particular group of people or the foundation itself?
Yeah, I don't know what other programs they have. I do know that for the Latino group, which is a large group, the Latino Affairs Office that's
Oh,
located in the Monroe County Library and other
Like the
places.
city.
Yeah, in the city, yeah. That is the go-to place.
Sure.
They have a social worker that's bilingual. It's the go-to place for a person who arrives in Bloomington and has no resources. That's,
When the grant was originally done, it was for just the Latino population.
Oh,
And a
okay.
private physician who was working through his office with it. And then HealthNet took over and it kind of went beyond the Latino population there.
Thanks for that clarity.
But they used to come once a year and give us a report.
Yeah.
Nancy, that
Before
was
the
with Volunteers in Medicine. Yeah.
And we could ask questions and find out what we needed to know.
Shelley would have been willing to come to tonight's meeting, but
However,
I suggested that since we had a lot of items and the budget on that tonight was probably not the best night. We could invite her to come
well,
in the
or
future.
she could simply send us a report, which would be fine with me also.
Yeah.
But it'd be nice to know who else they're reaching out to and whether they, you know, where they're gathering funds from, other than from us.
Yeah.
I think
Okay.
this constitutes what they consider the report.
Yeah.
Yes.
And I appreciate you getting this.
Yeah.
This took a lot. This took a lot.
Okay,
Yeah, I don't know what else. I don't know where else they're getting their money. I have no idea. I mean, I don't have anything to do with HealthNet. I did volunteer there for 5 years after I retired from my practice, but yeah, I mean, well, semi-retired from practice. All right, we have a motion on the floor and any further discussion? Okay,
was it seconded?
yes, it was.
Okay,
So George's motion, just as a reminder, was to continue the funding for the prenatal care grant through HealthNet and then and to increase it by $5,000
Right, for the next.
to 20,000 for the next cycle. All those in favor, please say aye.
Aye.
Opposed? Motion passes. I'd be happy. I'm going to deliver that news. They'll be very happy. Okay, Lori, we get to look at the
budget
budget.
discussion, adoption.
Okay, good.
And I assume that one,
I have an old agenda. Thank you.
that's the one.
Well, tonight, we're going to discuss the budget. It does not have to be approved until our next board meeting. We could approve it tonight. But if there are items
It would
as we
be
go through,
awesome to approve it tonight.
as we go through the budget, we're going to, Lori is going to highlight and explain each category. Actually, she's done that
Really?
on this little thing. And then she's going to highlight any major
It's like a
changes from last year, which will
Little.
Yeah, let's hope.
She's
Oh,
not scared.
unplugged maybe, the app?
It's not blinking.
So just a quick overview here, 1159, that is considered our health fund. It must be titled that according to state code. This is tax levy money. If the county opts in to Health First Indiana, the county will still have to contribute to this fund. And for 2024, that amount, the minimum amount they must contribute is the average amount of the past 3 years. That amount for 2024 will be $984,595. sometime in September.
Have we had any
For
indication
you.
they're looking at it to positively or negatively or?
I've been told that, they met with the legal department to discuss it. That's the only thing I know about it. So major changes to this, fund versus previous years is that, a lot of the personnel has been pulled from this fund into this Health First Indiana funding. So I have kept the majority of the environmental health specialist positions in this fund. One reason for that is just to make it easier when I do the budgeting for Health First and staying within that 60-40 recommendation for the split. In addition, keeping the financial manager and the administrative assistant positions in this position helps to just eliminate the need for me to tie that to a core service. I have added a clothing allotment amount of $250 for 3 additional personnel who are assisting in wastewater. So this is the environmental manager and then our 2 general field specialists. That was a new line from last year for those who are working in wastewater. The health officer salary has been moved to the contractual line, so no longer paid under the employee line, but under the contract line. This includes the contract for the health officer and then the medical director position for Futures Family Planning Clinic. We have increases for phones, hotspots, training, travel, and postage and freight. So these are all needed just due to increases needs for staff, mileage, gas costs, and such. Vax care line, let's see, somewhere, yeah. So that's the line that we pay out when we do the vaccine administration fees that we split 80% to IU Health and retain 20%. We are going to, I'm going to be working with the financial manager to begin appropriating the revenue. So I've only kept $10,000 in that line. Once we can start appropriating the revenue that we receive, we'll be able to have that to pay out. In the past, they were moving money from other lines to cover that percentage, and we're not really sure why, but we're going to figure that out.
Do you know that's there?
Sure, we have it. We have done a breakdown to show those revenue amounts for 2022 and 2023 so far for the health department and IU Health.
Does anybody have a burning need to see the Vax Care revenue?
I'm
frankly
sorry.
don't. I believe you.
Okay.
Okay.
I didn't hear what you said, Aurora.
Do you have a need to see the Vax Care revenue?
No.
Okay. If no questions, concerns, comments, we can move on to the next. Health First. Health First, okay. So 1161 is the new designated fund number from the State Board of Accounts for counties who opt into the Health First Indiana plan. The 2024, so there's currently a minimum amount and then a maximum amount. That final number will be determined on the number of counties who opt in. Let's see. Highlights of this, the community health specialist tobacco educator role has been moved from the trust account into this fund. And funding to cover the emergency preparedness assistant and emergency preparedness supplies and services have been moved here as that grant is going away in 2024. New request for position, proposing to move the DIS program coordinator into this position. That is a highly important and needed role. We need
What does
stability.
DIS stand for?
Disease information
Information.
specialist. sorry, for committee action items. This will offer the stability that we need as well as, the high demand and coverage with the 12 counties that we currently serve. We will be losing, one of these grants in 2024. So this just helps to free up some of the remaining grant that we will keep to be able to, rehire for a position.
Do we get anything from those other counties that feed into that position at all?
Not currently.
No, no STD district office gets anything from any of the other counties.
Okay,
They just get to benefit. So if we move Miranda here, that, then you could potentially have her salary that now is coming off the grant to keep one DIS. And so, because when we spoke, you said you were gonna lose 2 as of January. So there isn't, I see that she's the only one moving over here. There isn't another request for another DIS.
We should be able to fund, I don't know what the grant money for the grant that we're gonna get again next year will be. Historically, I've been told that it covers 2 full-time. This award this year covers a full-time and a part-time. It could potentially cover a full-time. It would be very tight, like especially with training travel. But there is a little bit of room and flexibility that I've left within this fund. If we need to consider adding to that or adding another part-time out of this line or the health fund, we have part-time funds to be able to cover that.
So just so you know, I don't know if this will come to anything, but there's a fair amount of national advocacy happening. A letter signed by roughly 20 national groups went to the director of CDC saying, don't take away this extra money for DIS, because if we have another outbreak of something, you again won't have people to work it. So if CDC has the money and you may end up getting some or all of this back, which would be.
It's not really a matter of if, it's when, when it happens.
Okay, thanks.
Let's see, and then the other proposal is an additional full-time for vital records. Services are increasing. Another one of the changes is that we will begin providing services to other counties besides just Monroe County. We currently have 1 part-time data entry clerk who has been trying to help and assist in vital records, which I could really utilize in other areas of the department. If we scroll down to the personal health care, so that is our contract line for our public health nursing. And the supplemental grant is going away in 2024. They are currently using that for personnel. The board, just to open for discussion, if the board would like to explore increasing the contract amount to cover the 0.6 LPN that is currently in the COVID supplemental grant, or keep the contract amount the same. I'm not sure why that's not the one I updated.
So in this, in 1161, we had also put a health educator in there, right? To do the injury prevention and all the other items required under the 60% that we weren't doing.
Yes,
Correct?
that was one of the proposed, that the board approved that. The county has not approved any of those positions being even taken to PAC.
So what you have on that spreadsheet does not include that new health educator position or the other ones that we recommended.
Correct. The vital records, which was one of them, but I have not been approved to take those to PAC for approval.
So what does that mean as a person who's been here less than a year? What does that, you haven't been approved to even request them?
That it's unlikely that we will have approval for new positions to fulfill these services.
County council is gonna say
Then,
no.
then how are we supposed to meet the 60% requirements of that funding?
Well, I think we are probably supposed to add those into job duties we already have.
That's not, that's
for
not
public health
feasible.
So do we march on county council?
Yeah, what do we do here? That's not feasible.
All we can do is show up and complain.
Because I had a meeting on my schedule that I thought was packed for August 1st, so you're saying that's not happening now because you haven't been approved to even show up there and make a request.
That is correct.
How do we express
who
that
approves
that's not
this?
okay? Yeah, how did this, maybe it happened in June when I was in another country, which is why I look so shocked to all of you, but
Happened before.
Yeah, it's happened
It's
before.
happened before.
Who does these approvals for this? I mean, who says that is it the attorneys that say we get the approval to go to the PAC meeting?
Is it a subcommittee of council?
There is
No,
a
that's
committee group that has some of the council members. I do believe the council attorney and then our HR administrator
Council administrator. as well.
and the council administrator.
So,
But okay, but we can take the two things that, like your position to the 35 from to 40, is that,
No,
not even that?
no.
none of the ones that we approved, she's saying, so all the work that we did and what we said, we need this, they're not even letting us make the case for it. So I feel we need to
Okay,
find out
well, I didn't
who they
realize
are.
that this
and-
was still, that at least those two things weren't gonna happen. I didn't realize that.
If we're not here to give expert advice on what we need and how to fulfill these new grant requirements, what are we doing?
and how to keep the people of Monroe County healthy. And then, obviously, we have to show up at a council meeting and make public comment, which it's our right to show up at any council meeting and make public comment. And just basically put it in their face that they are not meeting their obligations to the people of Monroe County. And I'm happy to show up there and say it because I love showing up. and
I
doing
wonder
things
if
like that.
Steve has some thoughts about having a meeting with somebody and.
Those people,
Those,
those people, whoever
I mean,
they
okay,
are.
so who should we talk to get this changed, to get these things on this PAC agenda?
Week after next.
How do we,
Do you
who do we
remember
talk?
we were trying to get some new positions?
Yes,
Okay, the person that I was president then, and the person we went through was someone that was assigned to us as a liaison, and that was Peter Alderson.
okay, but he's not the person that's our liaison now, is he? No.
No, Trent and Jeff are.
Oh, okay.
our liaisons.
I'm happy to go talk to them.
And
Okay.
Molly
Who's
is the
those?
one who met with Dr. Britton, myself, Molly and Kim.
And Ken, right?
Mhm.
I would, this is beyond frustrating.
Thank you.
Because I thought at least we had those two, your position and what was it, the financial, I can't remember what the other position was.
So assistant.
There were two
Right.
things.
They were gonna start at the administrative tier, do job classification, do a job description review at those, and then start working the way down on the rest of the positions and the job
So
description.
these had to be
what I was
whisked,
told.
right?
Yes,
This is the whisk.
This is
Are we stuck in the whisk
yes.
wash?
It's not what we wished for.
The
No.
whisk web, the
Uh,
whisk web?
It's not what we wished for.
No.
Eric, I like it.
That was
I like
good,
it.
Sarah.
Whisk is a process consultation
So you
with
could reach out and
salaries
talk to Molly about it.
and positions that the
Dr. Bridges.
county has to go through to
Joan as well.
get anything approved.
That would probably be
Apparently
good to
it's
have him
jamming
be a
everything up
participant.
for the new positions that we requested.
Is he,
But they're not even here.
was he out of town
Mhm.
again today?
No, we're not dealing with it. It's any kind of a urgent item.
I asked for both the panelists. So hopefully he's.
And I'm sorry,
But that's why I left a cushion in this, because I can't go anywhere with what I don't, with everything up in the air.
should we let you finish up presenting the budget and then
Yeah.
come back to this?
I'm happy to do that.
Because this. It seems like we digressed a bit
Yeah.
because we didn't know this shocking.
Because we got angry.
So 1168.
So 1168, this is our,
Oh,
local.
I'm sorry. You asked a question about, do we want to increase the personal health care contract for public health nursing?
Yes, do you want to
Can we do
consider that?
that? Are we allowed to do that?
Yeah. I can hear what you mean.
No. Well,
I
I
don't
think
know
you
what
make the
they're allowed to do
recommendation
or
to
not.
this board or to this budget,
I know,
and then
ignore us.
council either approves or denies
They ignore us again,
budget.
again.
Hello.
Oh.
Hello?
Hi, this is Dr. Britton. I've been listening this whole time, but just now was able to actually join as a participant. If for some reason I was blocked from actually speaking up.
It wasn't on purpose.
No, I know that. I'm actually in Chicago doing this remotely, but a couple things. I think the board needs to get a little assertive, as you guys sound as if you're ready to do that. And I think it would be in everybody's best interest if you could. We're meeting some catch-22 problems. Lori really needs to be a 40-hour employee. We've got a couple others that need to be ramped up as well. We're getting some pushback from, we can't do it because the left hand doesn't know what the right hand is doing. My understanding is that the board has to voice approval first, and we can take that then to the county attorneys and the commissioners and so forth. Correct me if I'm wrong about this, Lori. But these whole issues with these people not getting more aware of the urgency of the items that we're dealing with could end up costing a lot of money and a lot of goodwill. And I am willing to do whatever I can at your direction to help make that happen.
Yeah, we did approve Lori's position to the 40 hours. We did that.
In May.
Yeah, I was gonna say at least a couple.
Oh,
months ago.
I know, a couple months ago, but they act as if that didn't happen.
Yeah,
Well, so I think they're looking now at the job description. The
Yes.
first step is the job classified appropriately? Everyone in the administrative tier, are those job descriptions? Does WIS say that those job descriptions should be classified as they are?
to what
And
this
then do
is.
they recommend whether that should be 35 hours or 40 hours? If they think there should be an increase in classification or an increase in hours. Increase in hours would go to a desk audit to then get data and information from that. But the first step is for Molly to draft up the job description changes and adjustments that we discussed in the meeting, present that to PAC for WIS.
Has that been
approval.
done?
No.
So
And here
this
we
is
are
a
2
very
months,
long
2 months later, and that still
process.
hasn't been done.
And meanwhile,
Right.
Lori's working hours she's not paid for and has been for months. So are they gonna give you all that back pay when they approve this? can we instruct Lori to stop to only work 35 hours a week? Because that's what I think she needs to do. If they're not gonna pay her for more than 35 hours, she needs to work 35 hours.
I don't think you can do it officially, but you can say, if I were you, I would work 35 hours.
Well, the board could make a recommendation to the county attorney and the county council that Lori be granted retroactive pay since this was approved in May by the board.
Well, it sounds like our approval doesn't get anywhere. Our approval is meaningless essentially if they're saying, oh, fine, but now we have to go through all these steps.
I understand, but I think that the board could go to could send a message to the council. Look, this has been approved. Do you want to pay her, or do you want someone working part-time?
Do they need to be reminded that it's not legal to have employees work when they're not getting paid?
That's part of the to me, that's a function for the board.
I agree. I think maybe if I went, whoever else wants to go, and would you be willing to go with us? The three of us? Because.
Are you asking me?
Yes.
Yeah, I'm going to be out of town for a few more days, but
Well, I mean, yeah, we can arrange the time where we can all go.
Yeah,
of
yeah.
course.
yeah, I'm definitely willing to be an advocate.
Great.
I'm discouraged to see Lori working this hard, and not getting properly compensated.
I agree.
Well, the financial manager position is all of the positions.
That too. Yeah.
The daily operations, all of those do need to be looked at and considered for reclassification. Those positions put in a lot of support work. I could not operate without those positions.
Well, what's the frustrating thing is that we make this decision. We give them direction, and here we are 2 months later, and the first step hasn't even been taken.
What do you think?
Right.
And the meeting is the week after next,
I'm serious, what do you?
right?
Right.
So what is legal's issue here? Why isn't Molly writing this description?
Argument, I think. is that we
She's
should
too
do
busy.
some of this
Busy with
because we
tax.
didn't know what we were approving.
abatement or tax.
She's the only person that can do this?
I don't know if that's the case, but she's the person that she and Kim are who I met with when Dr. Britt was there. What we did spend a lot of time. We spent over 3 hours going through my job description, Jamie's job description, and the financial manager job description to make sure all of those duties were accurately represented in what's being performed and required of those positions daily. So a lot of time has already been put into it. I think it just needs to be written.
Maybe
Well, that's good.
we should get our
It's
friend
good
Boris
that
to
got
write
done,
a.
but then remember, we've still got the new
we should
health
get our friend
educator,
HD Boris.
whatever new positions you're gonna
to
put.
write an article about.
Oh, believe me, I'm
Sure.
beyond frustrated.
And
I mean, it's very hard to operate and function as an administrator.
okay, so you guys, there will be a meeting. If I'm here, I'm happy to go to. I'm gone next week, but then I'm back. But if you can do it next week, you should do it next week.
If we would, yeah, because I'm gone for a week, August, leaving January or July,
Does Dr. Britton want
31st, maybe
his
got
hands for some stuff?
6 days there. So,
Okay.
Well, and if I can interject here on that, officially part of the board, but like, we've also been trying since February to get the temporary status removed. And you guys, this is another thing that you guys approved to remove the temporary status from the temporary environmental health specialist. That's also been completely put on the back burner, but we've been told that council didn't want to fund it for this year, so trying to get funded for next year when we can't even remove that temporary status yet is, I'm assuming that's also going to be an issue as well. So, and Matthew's been doing great. We actually got emails where people are complimenting how helpful he's been doing and also we definitely need to keep him, so for.
Okay,
stuff
so,
that's
so here,
admissible.
so, okay, we want to, well,
Well,
if we get
nothing's
if we get a meeting set up, I'd love to go. The only thing we would need from you are the exact things we need to address in here.
Yep.
That's
Yeah, we don't
all.
want to leave anything out.
Yeah,
We
I
wanna-
want
we
the
want that-
exact
this
things
temporary
that
thing.
we need, that have we approved, like temporary thing, because I can't remember when it was.
The
I
health
remember doing it,
educator.
but I don't remember what it was.
That was in 2022.
And then.
We had all the population
What's
health. Yeah,
2 months ago, we approved, the changes to your job and the,
Health educator,
yeah,
and then whatever other positions we had in there.
administrative
We'd have to go back and
assistants.
check the notes.
and actually the first step hasn't been taken.
I think it's right here.
there was five new positions. I believe.
Yeah, well, the new positions, I'd just be at least happy if we could get the first two things that I thought would
Financial
really be done
manager, health
quickly.
educator, health administrator.
And the temporary status, we
Lori's
can't lose
job.
that
And the
position.
temporary
The
status,
minute
right.
Temporary
to
status.
Show how valuable that new position is.
Yeah.
I mean, going from 2 years of doing 30 work orders a month to over 100.
Yeah.
They're rocking and rolling.
Yeah.
That position needs to stay. That's why I put it in the 1161 to try to help keep it secure.
Yeah.
I'm not asking the county to fund it. I'm asking them to approve the state to fund it.
Okay,
So, so let's say we go to Molly and she says, okay, it's done. Then what? It has to go to the council or to the commissioners?
To that personnel administrative committee. to
That's at
pass.
the council level.
And then. they-
And that's the PAC?
yes.
Okay.
Oh, I thought, so it doesn't go to WIS until after the,
The PAC has to, they approve that.
The
Did it come
request.
The
go-
request that it should go to WIS.
We aren't even approved. It's like we're so far back.
wow.
Has to be approved to go on the agenda and then.
And my concern with all of this is that if they don't understand that we need these positions before September 1st, because they have to opt in, and all of these new positions should technically be hiring for them, or at least making a plan, we won't be able to fulfill the new grant requirements from the state.
Yeah,
That, like, it's all part of they seem to not understand, it's all part of this.
The hiring processes are changing too with new positions. So there will be a requirement that any new position that's approved with this funding has to be posted for 30 days before you can
Yeah.
hire and fill it,
Yeah,
which is going to be another really challenging
yeah.
hurdle.
So September 1st is the hard deadline.
For
Well,
opting in.
here's the thing with the September 1st is we have to give them an outline.
It doesn't have to be hired.
We have to opt in and we have to give them guidance on how we want to spend the money, not how we're actually going to spend the money. And so we've got a little bit of wiggle room, but we really do need to have these things off the ground pretty darn soon.
Yeah,
I mean, we're talking about $1.5 million, somewhere between $1.5 million and $2 million coming to the county for public health
yeah,
Well,
through
yeah.
SB4. And there's a hard stop September 1st for opting in, and that means that the council and the commissioners have to sign off on it by then.
Commissioners won't be a problem. Commissioners will do it. It's so that it's just got their heads up, but that's.
which is, I just want to say that kudos to Lori for even coming up with a budget with all the uncertainties, whether she's going to have positions, whether she's going to have, the county's going to opt in. I mean, it's really been a struggle, another struggle. Yeah, Lori,
I agree. I couldn't do it.
again. So,
Should we get back to her budget presentation?
Yeah.
So we can
yeah, let's do this.
finish this up? 1168. Oh, we still didn't vote on that personal home care. So this person works at public health nursing. And presumably they do outbreak investigation, give shots, things like that.
Yes, so it's really TB case, TB-led case management, infectious disease.
Well, we've got to do that under the 60% anyway.
Right.
Correct,
So I would say yes. I would say yes, we wish to explore increasing the contract $50,000 to $60,000 to remain covering 0.6 FTE and LPN.
Or
Are you
second,
making a motion?
That's my motion.
I second.
Okay,
Okay. Any further discussion on that? All those in favor, please say aye.
I,
Opposed? Great, got that done. So now,
no.
1168.
Okay, short and sweet, really, but this local health maintenance, historically, this has been based off of population size. Was paid in 2 installments in January and July to health departments. These are non-reverting funds. If the county opts in, then we can still use the cash balance until those funds are spent down, then these accounts will close. If the county does not opt in, then a legacy amount will be awarded into this account versus the Health First.
Gotcha.
I have appropriated some money in this line for a part-time line. It makes sense to me to go ahead and make sure that this money is approved and appropriated in this count to be able to use versus having to try to make a request later on.
Agree.
1206. This is the trust account. So this was tobacco settlement money. Again, this money we will just use until it's spent down, then the account will be closed out. That's pretty much regardless. This account was always going to go away once the money was spent.
And how much money again do we have in that?
It's up there. My vision.
61,810.
No, 149. Yeah,
$149,113
yeah.
as of June 2020.
We asked
Oh,
every
yeah,
year,
gosh.
when's the date it goes away, do you know?
I don't. Let's see,
We never remember, I mean, we had.
yeah, and so there is still some money that's coming out of both of these accounts, so that amount will change a little bit because we are paying the tobacco educator and some part-time funding, but again, I've just proposed appropriating some money within supplies and services, training and travel that can still be used by our tobacco educator to have that money for programming costs. 4906. My understanding of this position or this fund was that it was established years ago, just as emergency reserve funding. So no plans for that money except.
Because we're not gonna have an emergency again. Nope, not doing it.
Well, that's a good plan,
Thank you.
Yeah.
Thank you.
but we now know that we could fix some of that money that we're not giving to carpet extractors. We could put into this emergency fund, but
Maybe we could put it towards the hospital, build more beds. Since they built it smaller.
Do we need to,
We're
Can I-
not giving any more money.
can I make a motion about accepting the budget?
Absolutely.
Thank you. I move that we accept the budget as presented.
I'll second that.
With the one minor change of the thing we
Yeah.
voted to
The LPN,
increase
personal
the
services.
LPN.
Yeah.
Yeah, that's in there.
Yeah. Okay, it's been moved and seconded to approve the budget as presented with the one minor little change. Any further discussion? All those in favor, please say aye.
Aye.
Opposed?
All right.
There we go.
I have a question for Lori. I don't understand back under 1161,
Mhm.
the fourth bullet point. Why are we assisting other counties with their
Counties.
problems related to vital records?
Mhm. So this is again, one of the changes that's been being discussed with the Health First Indiana and all the changes to legislation about increasing the capacity for this service. So if we were to be requested by someone outside the county, that we would have the capability, and the Indiana Department of Health has been trying to work on their technology and their systems for access. I don't know the whole backstory with it, but I could get you those details.
But we would need part-time data entry clerk to do that. It sounds like.
Well.
Well, I really need a
Actually,
part-
1.5 positions, right? Is that,
Yeah.
am I reading this correct?
We
Correct.
currently have a part-time data entry clerk that I need to be doing data entry, but is assisting with vital records because to help fill the gap that we have there. So we still have that part-time data entry clerk. She would just be doing data entry and then helping with our document retention and destruction that needs to occur with the department. So there's years and years and years worth of documents in the attic and throughout the department that nobody here has the time or capacity to go through.
So this would get us one new FTE in vital records.
Yes,
So we would be increasing capacity to take care of those other counties. Should they choose to opt in
and approve the position.
and approve the position.
Okay, thank you. I think I understand now.
Okay. Anybody else have any comments in general about? I think we've covered our feeling about the council and their action. Anything else, or inaction, I should say?
Have we covered the agenda items?
Yes.
Oh,
Yeah.
I think we have to have public discussion. Is there?
Okay, is there anyone from the public who has comments in the meeting? Yes, thank you for reminding me of that.
Oh, does that mean? It looks like one of our staff was online.
On the public. I am I'm very interested in the lack of attention the county is giving to these requests that the board has approved and recommended. And I would like some more information so I can go and speak as a private citizen.
Thank you.
And it's specifically, it's the county council.
Right.
You
Yes.
should introduce yourself.
Oh, I know some of them, so.
I mean,
No.
you should introduce.
My name is Nancy Goswami. I've been in Bloomington for 15 years. I am married to a neurologist here in Bloomington.
That's why, that's why I know
Well,
your
he
name.
used to be here.
Same name, same last name.
Yes.
different last name.
Now he's at Lexington, Baptist Health in Lexington, working 7 days on, 7 days off instead of 7 on, 7 on, 7 on, 7 on, 7 on, 7 on, all the time. And I'm also a registered nurse, but I stayed at home with our kids. I'm on 2 nonprofit boards here in Bloomington. And I'm here with the league today. So public education and health are 2 of my interests. So that's why I chose to come and observe. I think it's very important that, we be prepared for another, for anything. And I'm here all to observe, but also as a private citizen, I would like to do whatever I can
thank
to speak
you.
up.
Thanks for attending. Yeah,
Thank you very much.
So, yeah, I'm sorry, I was taking notes and everything, but I'm just for my own self. And then I'm with, George with the League of Women Voters, so I'm not sure what I'm supposed to report back to them. So I just wrote as much down as I could, so.
good.
Well, feel free to reach out to me via email, and I'm happy to connect with you as well.
Okay, I think I have Jamie, and I think I have your email from George, and I can email you, and then you can send that to Lori, and I would be willing to speak. Yeah,
Great.
because I'm shocked that you
We
know,
were
you're
shocked
making these
too.
recommendations and nothing is getting done, even your job description hasn't been written up yet, although you spent all that time working on them and creating them. It's just a few keystrokes on a computer and it's done. You know, so,
Well, I would like to make one more
Yeah.
final comment, and that is these are the kind of problems that we face here, and in public, we have been somewhat skewered in the local press for inaction, or at least the innuendo was there that our department is not functioning, and nothing could be further from the truth. Even during all of that time, and there was some turmoil, the department was still functioning, and there was never a time where we weren't actually doing the job that we have a mandate to do. Today, we have some of those departments doing multiples of the things that had been done over the last previous several years. And some of those changes that took place during that period are directly related to the good job that Lori and her staff is doing. So our frustration is that we have things holding us back from even going to the next step. And these are things that, you know, you've heard here tonight about. We're doing our job, and we hope that the rest of the county employees will start doing theirs and help us in the ways that we need them to help us in a timely manner. And so those are my comments, and I'd like to close with that. Do I hear a motion for adjournment?
Don't we need to set the next meeting? Or are we just going to say every 4 weeks?
Third
The third
Thursday.
At 5:30.
Okay.
Yeah.
Good enough.
Thanks for including me. And by the way, it wasn't really innuendo in the paper when I read it. I think it was
Pretty clear.
Well,
But
but the underlying, but the underlying tone is that something is really
Right.
wrong there, and that, you know, without any,
Without properly
Yeah.
investigating. what
Yes.
was really
Yeah.
going
it was
on.
very one-sided.
and I have worse on speed dial. I don't know if you remember the two articles about IU Health there, that they lost their gold, their stroke
Yes.
certification.
Yes,
That was my husband they interviewed.
Yeah.
My husband they interviewed my husband for that first article and then cited Boris, wrote it and then cited him. And I was very instrumental in getting that article written because I'm just appalled that they are not stroke certified, and I don't know what their catchment area is, but
Yeah.
it's pretty frightening.
9 to 10
Yeah.
counties.
You should come spend the day. with
I move
me.
to adjourn.
You can get all
Where
about
are
a
you?
lot of things.
Second.
Where are you?
I'm an anesthesiologist at the
Yeah.
hospital.
Are we adjourned?
Yes.
Okay, thank you.